Hello, I'm Nick Maffiuletti from the Human Performance Lab at the Schultes Clinic in Zurich, Switzerland. And let me go away from here. In relation with the imminent congress of the Sport Physio Association about the knee and sports, which will take place online on November 13, I was asked by Sport Physio to give you a 20-minute presentation about a hot topic related to my field in relation with rehabilitation. So that's the title I choose for my talk. We need more focus on explosive strength in sports rehab, evidence and practical implications. And I will try to go through a few slides with you just to share my thoughts on this topic. So this is the general rationale from my side for permitting an effective and useful implementation of explosive strength in clinical settings. And from left to right, it goes from better understanding of what's explosive strength. For example, what are the main determinants of this capacity. Moving from the evaluation of explosive strength for implementing better clinical methods for assessing this capacity, and ultimately implementing rehabilitation protocols with more focus on this capacity. So through my talk, I will go always from evidence in relation to what we know from more from scientific studies to practical implications, and that will be, I hope, as clear as possible in terms of when we speculate or when we see some opportunities. So what's explosive strength? That's basically the capacity to generate force and not necessarily maximal force. That's why it is different from maximal strength, as quickly as possible. So this capacity is also referred to as quickness. It usually takes place within 100 to 100 milliseconds from contraction onset. So it's a very specific way of producing force. It is very often quantified as the RFD, the rate of force development, which is nothing but a change in force over a short time interval. And we'll see later on how it is usually quantified. And when speaking about other neuromuscular variables, we can say that rate of force development is a cousin of maximal strength, 1RM, MVC, whatever. And he's a brother of power and speed capacity. Why is explosive strength and RFD important? Probably the most important point here is that it is more functionally relevant than maximal strength. For example, if you think about the timing for producing an effective contraction, you have an example here for most of the track and field disciplines, but it also applies to a majority of team sports. The time available to produce that force is less than 200 milliseconds, and that's exactly the time corresponding to the interval when we refer to explosive strength. And that is clearly nothing to do with maximal strength, which is usually produced after 500 or more milliseconds. And then, of course, besides performance, producing force quickly is also extremely important in daily activities. So, for example, correcting your body posture after following a perturbation, or even if you think about injury reduction, you can imagine what happens in the knee joint of this lady after this sudden alteration of the postural control of her body. And that time required to correct body position or to adjust an improper posture is often closer to the time interval in relation with explosive strength rather than maximal strength. Again, less than 200 milliseconds. And then, of course, explosive strength in the last few years has been shown to be more sensitive than pure maximal strength, which has, however, been quantified for more than 50 years, for assessing acute changes in performance, for example, in relation with muscle fatigue or muscle damage, but also chronic changes, for example, induced by pain, induced by injury, training, and or rehab. And I will make a few more examples in the next slides. So what's the evidence in terms of our understanding of explosive strength? So do we know what are the main determinants of this capacity, especially in relation with maximal strength? And I will tend to say yes, we know that very well since last year for explosive strength. We still don't know very well for maximal strength, but we tend to think that maximal strength is way more affected by muscle mass, muscle volume, rather than explosive strength. However, what we know very well is that explosive strength is highly influenced by neural factors, and in particular by the discharge rate of motor unit, which is nothing but how many action potential are discharged from the central nervous system to the muscle to produce a quick contraction. And we know that again since last year, because there have been major advancement in the techniques available to evaluate neuromuscular function in vivo with non-invasive methodologies. And for example, here what you can see in this graph, of course you can refer to the original study, but we don't need any more to implant electrodes to understand the behavior of motor units, so to have a window on the central nervous system, but now we can simply stick surface electrodes and try to extract information related to motor unit properties. So here you have an example of a muscle force evoked. Of course, it's a voluntary contraction with a quick and fast beginning of the contraction, which is then sustained for about 3 seconds. And the different colors are each different motor unit. From the lowest to the highest part of this graph, you have different motor units discharging at different intervals. And with this methodology, this is just amplified in the early part of the contraction. You can see how the discharge rate of these units is higher here compared to the next phase. And you can also see how the discharge rate is higher for some motor units compared to others. And of course, when you get these timing properties of the motor unit behavior, you can track discharge rate, which again it is also called firing frequency, whatever, but it is usually expressed in hertz or pulses per second, and you can see how the discharge rate is very high at the onset of an explosive contraction, and afterward it is much lower during the second phase, where usually we measure maximal strength. This is just to give you a very quick overview of this methodology, which is a major breakthrough in scientific research. Again, to have access with surface electrodes, these are matrices of 64 electrodes over the vastus lateralis and medialis of this subject, from which you record basically just surface EMG activity. Each color is a different channel, so you see there are 64 channels. Black is the force, and from each channel you then can decompose the signal, starting from the principle that each motor unit has a different action potential shape, so we call it also a signature. We extract basically the same motor unit within this interference signal, and then we are able to track individual motor units, including over time. And that's basically how this research team demonstrating a very strong link between explosive strength, which can be quantified in different ways, of course, and the maximal discharge rate of motor units. In this graph, each color is a different subject, and you can see that the relation can be really very high. So, contrary to maximal strength, for explosive strength, we have a very clear picture of a major determinant in explosive strength or rate of force development capacity, which is motor unit discharge rate. And motor unit discharge rate has previously been shown to be reduced with disuse. So this is an example of a bed rest study. Reduced with pathology, reduced with aging. So we have another good reason to focus on discharge rate as a main focus of our rehab program. And also considering that discharge rate has been shown to have a huge adaptability to training and rehab. And then, of course, if we think about the practical implication, once we know the cause or the major determinant, what are the implications? And implications are pretty clear. So we will do whatever we can to treat the cause, not simply the consequence. So reduced explosive strength is a consequence. So a specific weakness of specific muscles after injury, fatigue, whatever, is the consequence. And reduced motor unit discharge rate is the main cause. So we then can propose a mechanism-based rehab where we're going to focus on improving discharge rate to improve explosive strength, and this should be the way to go, of course. And just to make you an example, is like treating headache or treating knee pain and focusing on pain, which can be due to a multitude of causes, and not focusing on the single cause which can provoke pain. Well, let's speak very briefly about evaluation. This would help implementing methods, especially in the clinic, that would help quantifying this explosive strength capacity. What's the evidence? And the evidence is quite clear. There has been a trend in the last 20 years, and now we speak about RFD as the neuromuscular variable of the new century, of this century. And there is clearly a shift from the old paradigm, which was assessment of maximal strength, as you can see here, from an involved and uninvolved side, where we basically then just compare the maximal strength, which occurs after more than 1 second from contraction onset, rather than now focusing on the initial part of an explosive contraction. So again, milliseconds instead of second. And when you focus on this part, that's what you get. And here you see the force time profile of the involved side and uninvolved side. This is a patient with a knee condition. And the major variables that are quantified in terms of rate of force development are peak rate of force development, which can be seen as the highest slope of the force time relation. And you can see how different it is from the involved to the uninvolved side. But also time locked variables, like for example, rate of force at 50, 100 and 200 milliseconds from contraction onset. And I will tend to give more importance to 50 and 100 as opposed to 200 milliseconds based on what we know. But that's quite clear. That's a methodology. It has been sort of validated by a multitude of studies. Now these are the major variables we need to refer to. And then of course, we can also evaluate the rate of force development from dynamic actions. This is an example of a jump where you can see the slope of the vertical ground reaction force traces over time that can be quantified as a surrogate of explosive strength. And then of course, if force plates are used or any other device that can ensure a valid assessment of force in a static or dynamic condition, all this calculation can also be conducted for dynamic action in eccentric and or concentric, with, however, some more methodological problems compared to simple static conditions. What are the practical implications from these methodological considerations? Well, there are studies which clearly show that implementing explosive action coupled with, for example, dynamometry are crucial for quantifying rate of force development, especially this is a study focusing on the return to sport phase. So these are basically professional soccer players who were operated for ACL surgery, who were tested with this closed chain leg press modality by measuring force with a very simple sensor that is positioned here. So one more time, forget you need a sophisticated machine. A load cell, which is approximately, it has a value of $200, can make clearly the job, and it will measure static strength during a maximal explosive action here. So basically what this team showed was that MVC was basically restored 6 months and then unchanged, at least from a significant point of view, 12 months after ACL surgery. So this person would be free to go back to sport. However, if it is explosive strength that is evaluated, so one more time, rate of force development during the early phase of a quick explosive contraction, you can see that at 6 months the impairment is still very large, and then there is of course a recovery later on at 12 months. So if we refer to these criteria, explosive strength, those players will never go back to play at 6 months, but they will probably go back if we just stick to maximal. So implementing explosive action with dynamometry and or simple surface EMG sensors. So now today there are sensors which are available, which again have a value which is close to $100 for bipolar recording, which is far than enough in clinical practice to do this kind of explorations. So basically here, this is bipolar EMG from, you can see different muscle. Of course, you can decide what you want. And then if you decide to implement surface EMG in clinical settings, you don't need sophisticated calculation. You just need to stick to the early phase of the contraction. So from the onset, this is the onset of 3 consecutive actions, and then just quantifying how surface EMG look like in the very first phase of the contraction. Here we speak about 50, 100 milliseconds. And you can see very well that, for example, EMG activity is larger here, less here, and larger again here. So from these just subjective observation, we can define as this trial as being less explosive than the others. And we can put focus, of course, with biofeedback and something else in relation to EMG, but of course coupled with explosive actions. And then last but not least, so if we speak about optimizing rehab with more explosive strength, more emphasis on explosive strength, what's the evidence? Until now the evidence is pretty weak, but in the last 3 years there have been editorials and review articles that I leave you on this slide. So time has come to incorporate more explosive strength. There is something about power and explosive strength, optimizing late stage rehab, and strength and power training in rehab with a focus on explosive strength. So there is a need for that, of course, with unfortunately limited evidence today that comes from maybe other fields. But let's give a look to the practical implications. So according to the 2 teams who focused a bit on that, one team proposed 5 phases of rehab and suggested to put more emphasis during phase 4 on explosive strength and rapid neural activation, which is exactly the key. So we should push patients to activate as quickly as possible their muscles to improve explosive strength. And the other team, they basically proposed as an example rehab after ACL reconstruction in a soccer player, and they showed what could be done at 6 months. They showed a few phases, and they insisted on phase 3 and phase 4 for implementing more rate of force explosive strength work. Well, but one more time the question is how to do that properly, and what we know from other fields is that there are at least 3 modalities that are extremely effective to improve discharge rate and to improve explosive strength. And these 3 modalities are: number 1, ballistic training. I will show you a video in the next slide, which is nothing but contractions, even submaximal, but extremely short. We speak about less than 1 second, with the highest rate of force development during the very first phase, and also highest rate of force relaxation, which is also crucial, where the intention is also very, very important. The second modality is explosive strength training, which is not very new. It's basically maximal acceleration of the load during the concentric phase of the exercise, and I also have a video for that. And the third phase is something that has been already presented with different approaches or with different goals, but it's basically sensory motor or perturbation training according to Fitzgerald, where basically we need very rapid contractions, also unexpected, to restabilize posture or joint complexes. Well, the goal for all these modalities is improving the rapid activation capacity, or the ability to activate muscles as quickly as possible. And just to give you two examples, so this is an example for a ballistic closed chain exercise. You can see so the very quick contraction and relaxation phase, and this is just an example where there are a few contractions in an isometric modality, just to see how fast the contraction should be, but also the relaxation, and then followed by some explosive contractions with less load and fast concentric phase, followed by an eccentric phase that is not the focus in this case. Well, there are also speculations in these directions, and of course today it's too early to speak about that, but if you think about the similarity between the time interval that is often mentioned for ACL rupture or other injuries, and that time interval is very often close to 100, less than 100 milliseconds from ground contact, for example, for ACL rupture. It is extremely close to the time interval we are referring to when we require patients to contract as quickly as possible during those 100 milliseconds. And then on another note, there are also speculations on the role of fatigue for injury as a risk factor for injury. And of course, what we know very well, at least from this perspective, is that explosive strength is strongly affected by fatigue, much more affected than maximum strength, as you can see, for example, from this graph. And I will tend to say the shorter the time interval, the higher the amount of fatigue. And then, of course, we can see a link with fatigue and the injury risk or not. But that's a bit the speculation we could do today on the role of explosive strength for injury reduction and injury risk. Well, to summarize, I'm sorry if I've been a bit longer than the allotted 20 minutes. The three key points are in terms of determinants of explosive strength. Remember that it's a neural cause, it's a neural origin, mainly with a decreased motor unit discharge rate, and that's quite an important thing to keep in mind also in clinical practice. The second point I tried to discuss was that we need to improve evaluation methods and make more clinical, simple tools that are available to focus more easily on early rate of force development and early EMG activity from explosive action. And last but not least, I gave you some examples about ballistic, explosive, and sensory motor perturbation training that could be easily implemented in phase 3, phase 4, even if, of course, with less loads and with some maximal trials, that could be done even earlier. And then, of course, we made some speculations about injury reduction. Well, I'm done with my presentation. This is my email in case you want to drop a comment, negative or positive, whatever, in case you have questions. And then I thank you very much, Sport Physio. I thank you very much for listening, and wish you the very best.